Hi, my name's David. I'm a nurse practitioner student, and this is my physical exam competency. We'll start by introducing myself to the patient. Hi, my name's David. I'm the one conducting your physical exam today.
Hi, I'm Jack.
Nice to meet you. We'll start by asking mental status questions by following the Glasgow-Coma scale. Can you tell me your name?
Jacqueline Pazelli.
And where are we?
Our house,
And the year?
2021.
So we'll give her a 15, and that's a baseline score. Next, we'll move on to inspection. I'm going to be looking at her hair for distribution, texture, and then I look at her skin. We want her skin to be warm, pink, and moist. We're looking for any alterations of that. I'm going to go ahead and look at her hands. We're going to be looking at her nail beds. We're looking for any pitting, press on her nails to get any capillary refill, right? For any clubbing too, you want to look. Then you want to start by palpating the head. You want to palpate the temporal arteries. Then you want to go ahead and palpate the frontal sinus, the maxillary sinus, any tenderness.
Nope.
You want to palpate the lymph nodes. So we do the preauricular, the parotid, the postauricular, the occipital, submandibular, the tonsillar, the submental, superficial cervical, deep cervical, the clavicular. And we're looking for any firm nodules or anything like that. Next, you want to palpate the neck, make sure the trachea is midline. You want to go from behind her, ask her to swallow. Push over the trachea with your right hand and feel the left side of the thyroid gland for any lumps, and do the same for the left. Push it over to the right. Okay. After that, we will be inspecting the eyebrows, looking for distribution and texture. And after that, we look at the eyelids, and we look into the conjunctiva and the sclera for any injection. We look at the lacrimal glands for any obstruction or infection. Go ahead and turn on the ophthalmoscope, and we're going to be looking for direct pupillary response and consensual pupillary response. Okay. And while we do that, we can look at the nares. We're looking for any drainage, injuries, swelling of the turbinates, any deviation of the septum. We go ahead and ask her to go ahead and look in her mouth, looking at her dentation for any caries. Open your mouth for us. Stick out your tongue and say ah. Looking at the uvula for midline, looking at the soft palate, looking at the hard palate of the mouth. Can you lift up your tongue? Good job. Looking at the dentation, the buccal mucosa, if it's pink, moist, the uvular roast midline. We go ahead and we look in the ears. We pull, before we stick our otoscope in, we make sure that there's no injuries on the external auditory canal. We pick the pinna up and pull it up and back. We look inside the auditory canal for any injuries. We look at the tympanic membrane. We look for cerumen. We look at the tympanic membrane for, make sure it's pearly gray, non-bulging, and that we see a positive conal light. And we're going to do for the ears. You want to do the Weber test right up top, and you test for lateralization. Can you hear both equally on either side?
Yes.
Good. Okay. Then you test for AC and BC, air conduction and bone conduction. I place the tuning fork near her ear, and AC should be longer than BC. And she's going to tell me when she stops hearing that. Good. And then we're going to test for BC. I put it right on the mastoid process. Good. Okay. When palpating the face, you want to make sure that you touch the temporal, the mandibular joint, and you want to test for any popping or clicking. Can you open your and close your jaw? Good job. When we test eyes in the clinic, we always use the otoscope, and from about 12 inches away, we take a look, and I'm going to close my right eye, and I'm going to go ahead and look inside your eye, and we're looking at the cup to disc ratio, and we're looking to make sure that it's sharp, there's no papillary edema or anything like that. When we test the other eye, and I close my right eye as I look into her left eye, her right eye, I close mine. For this part of the cardiac and circulation test, we're going to start off by inspecting Jacqueline's precordium, and we're looking for anything abnormal or adventitious. Then I'll go ahead and I'm going to be palpating the precordium for any heaves and thrills. I like to use my pads and my fingers to do that. Then I'm going to be auscultating. I'm going to be listening to the aortic the pulmonic, herbs, tricuspid, mitral. And then while I'm here, I can palpate for the point of maximal impulse, which is right at the mitral line, at the midclavicular, down at the 5th intercostal space. And then you want to go ahead, and while we're down here, we're going to be listening to the carotid. And take a breath for me. And just hold it. Okay, and turn the other way. Take a breath and hold it. Good, you can release. Okay, and then we're going to take the bell and we're going to go through the same spots, and we'll be looking for any adventitious sounds. We're looking for murmurs now. You just flip it over. I like to start at the mitral spot and work my way back to the tricuspid, herbs, pulmonic, and aortic. While we're also here for circulation, we can look at her jugular vein for any JVD or jugular venous distension, and there is none right now. That's good. And then we will also be looking at her pulses while we're here too. We can look at the brachial pulse, and you want to feel both. You want to feel for equal pulses, strong pulses on either side. You want to do the radial, popliteal. We're going to do posterior tibial, and dorsalis pedis is right on the top of the foot. Special test you can do for cardiac and circulation is test for aortic insufficiency or aortic regurgitation. And what you ask the patient to do is you ask them to lean forward, inhale deeply and hold their breath. So for the second special test for the cardiac circulation, we're going to be testing for mitral stenosis. So go ahead and we're going to auscultate. You want to palpate the point of maximal impulse on the left side where you felt it before. Mid-axillary 5th intercostal space. You want to go ahead and take the bell of your stethoscope and listen for that mitral stenosis if there are any. Okay, moving on, we're going to test for thoracic. So basically we're looking and inspecting the anterior part of the chest, the posterior part of the chest, and the lateral part of the chest for rise, right? And then we're looking at her respiratory rate over a minute, and you want that to be between 16 and 20. And if she's not having, taking too many breaths or using retractory muscles for adventitious breathing, then you want to go ahead and palpate the chest wall for any tenderness, posteriorly and anteriorly. Then you can take the sides of your hands and you can ask them to say 99.
99.
And that's testing for
99,
tactile fremitus.
99, 99, 99.
Good job. And then we do the front.
99, 99, 99, 99.
And you're placing your hands in between the intercostal spaces. Next, you're going to go ahead and test for thoracic expansion by placing both hands on the back. And you want to bring your hands closer to each other to get that skin to fold up, and breathe in for me. Good, symmetric expansion. And you go ahead and do the same in the front. Then we're going to go ahead and listen to her lungs. We start at the apex and work our way down to the base using the stethoscope. And we use a lattice type fashion. You'd be listening for one full breath cycle. And you want to listen to the lateral side of the lungs. And keep taking deep breaths for me. Good job. You want to listen anterior, posteriorly. You're listening for any crackles, coarse breath sounds. Make sure you get the 3 lobes of the right lung. When testing for any adventitious breath sounds or any pathological issues with the lungs, you want to palpate, and you want to start at the top of the lungs and you work your way down, and listening for any tympany, dullness, or any hyperresonance. And we do this anteriorly and posteriorly. For the next part of the test, we're going to be working our way on the abdomen. So we ask our patient to lay supine with her arms at her side, legs flat, and an empty bladder to make her feel comfortable. Also, to maintain her comfort, we're only going to expose the area that we need. So I'm going to lift up Jacqueline's shirt, and we're going to inspect her abdomen for any scars or hernias. Next, we will be auscultating the abdomen, and we're going to be looking for vowel sounds in all 4 quadrants. starting at the right lower quadrant, right upper quadrant, the epigastric, the left upper, the left lower. You want to listen to the aortic, the renal arteries, the iliac arteries, and the femoral arteries. You want to percuss the abdomen for tympany and dullness. Then, while you're percussing, you want to test the liver span. So you will look at the McBurney's point, and that is a third of the way away from the iliac spine and the umbilicus. In the fifth and the midclavicular line, you work your way up till you feel the dullness of the liver, the lower border's edge, right here, right underneath the last intercostals, and then you're going to work your way down to find the upper border of it. For splenic dullness, you're going to go to the left upper quadrant, and then you're going to work your way to the lateral side, looking for tympany over that gas-filled area, and then any dullness would be into the anterior lateral side of the left side of the patient. Next, we're going to be palpating. You want to start with the light touch first, starting at the right lower, and this is McBurney's point. If at McBurney's point, this would be any tenderness would be appendicitis moving up. You'll feel the lower border of the liver if it's inflamed or enlarged. You want to do all four quadrants. You want to do a deep palpation on inspiration. You breathe in and then breathe out. And when the patient exhales, you can feel deeper. So you really want to just press in when they breathe out. Good job. Okay, the next test we're going to be doing is the SOS test. I'm going to be placing one hand above the knee, asking the patient to raise her leg. If it was positive, it'd be positive for appendicitis, and she would have right lower quadrant pain or right upper quadrant pain. Then we're going to do the obturator test, where we're going to ask the patient to flex her knee, and then I'm going to internally rotate, and there would be the same pain right in the right lower quadrant for the appendicitis. Then what you want to do is you want to palpate for aortic pulsations, and you want to feel out from either side of the abdomen in the epigastric area, and you want to move your fingers in for 1 to 2 centimeter width, and good, you feel it. Okay. If Jacqueline, you can just sit forward for me. We're going to be testing for any kidney stones. We're going to be testing, and you're going to be doing a deep percussion on the CVA, the costovertebral angle in the back, and if there was any pain, that might be positive for a kidney stone. And then for Murphy's sign, you're going to go underneath the costal area. Good, thank you. And you're going to ask the patient to breathe in and breathe out. And when you breathe out, you'll feel the gallbladder. If it's inflamed, it will hit the edge of the tester's hand and elicit a pain sign, which might be positive for cholecystitis. We are going to test the musculoskeletal system. And in order to do that first, we're going to ask Jacqueline to test her gait. So we're going to stand up, walk to the front of the wall, walk on back, okay? And then if you could do heel to toe. So there you go, heel in front of your toe and then back. We're watching for her gait and any cerebellar lesions, Parkinson's disease, anything that would make her gait wide or unsteady. And then I'd like you to walk in tandem. So it just means one foot right next to each other. Good job. And then back. You can go ahead and sit down. In an elderly patient, you do the stand and go test, and you want it to be done in 10 seconds to test their risk for falls. While Jacqueline's sitting there, she can also show us heel to shin by bringing a foot up, placing it on her shin, and then bringing it down on either side to show us good coordination. Next, Jacqueline's going to show us range of motions. So we're going to do neck flexion and extension. We're going to do lateral bending to bring your ear to your shoulder, rotation from side to side. And then I'm going to stand off to the side. Jacqueline, show me abduction of your shoulders, bringing them up, and then abduction, adduction, bringing them back in. And then internal rotation of your shoulders, and the external rotation of that shoulder. Good. Now, like a bicep curl, show me elbow flexion, and like a tricep push down, elbow extension. And then I want you to show me supination, like you're holding a cup of soup, and then pronation. Good job. Next, we're going to be moving on to wrist flexion and extension. And then I want to see ulnar deviation and radial deviation. While your hands are up there, can you show us finger abduction and adduction? Good job. And finger flexion and extension. Good. Do you mind standing for me? We're going to show everybody, in an able-bodied person, I'm going to ask Jacqueline to show me hip internal rotation coming in and external rotation going out. Can you show me abduction and adduction? Good job. Can you go ahead and sit down for me? Okay, great. Now we're going to be moving on to knee flexion, right? And extension. Good job. While your foot's out there, show me plantar flexion, and then dorsiflexion, and then inversion and eversion. Good. And you bring that foot down. And lastly, we're going to ask her to lean forward for flexion of her spine, and then extension. She just sit back forward. Great. Lateral bending, side to side, and then rotation. Okay, good job. When we test the musculoskeletal system, we can do special tests, especially for the shoulder, looking for any adhesive capsulitis, any rotator cuff surgery, sorry, not surgeries, but injuries that may need a surgery. But we want to do a few tests. So I'm going to show you the test with you. Basically, you're going to bring your arms up and then cross them on over your body for the acromioclavicular joint crossover body test. And then I would like you to act like you're going to be scratching your back for the Apley scratch back. And then go and, yeah, good, an internal rotation on that. And then I'm going to ask you to flex your arm all the way up. While I do that, I'm going to engage the posterior deltoid and cause an impingement in her shoulder. And then I'm going to ask you to, like a bird, make a hawk sign, and I'm going to press up and impinge your shoulder like that. And then I'd like you to hold your arm up like that, externally rotate your hands out like this. If her arms brought them back in, that would mean that she cannot hold the external rotation. Then I'm going to ask you to bring your arms, abduct them out to the side and hold them there. If she couldn't hold them there, that would show us that there's a shoulder injury. Lastly, bring your hands in front of you like you're holding two cans. Turn them inside out. I'm going to put some pressure on them. If her arm would drop, it'd be a positive sign that there might be a shoulder injury. While I have her here, I can also have her stick her hands out in front of her, and we're going to do the Finkelstein test, which is one of my favorite tests because I love the word. And you're going to stick your thumb inside, and you're going to grasp it with your other fingers, and you're going to flex down, and that would be positive for de Quervain's, right? And you're going to flex down. Yeah, good job. Then you're going to turn your hand up like this. You can take your stethoscope if you want, a reflex hammer, or you can just use your fingers, and you're going to tap right at the carpal tunnel. And if she would feel any burning or a nerve pain sensation, would be eliciting of a carpal tunnel syndrome. Lastly, you could do Phelan's sign, which is putting your hands together like that. You want to hold it for at least 90 seconds, and she would feel numbness in her thumb, index, and ring finger. Sorry, not ring finger, the middle finger. Thumb, index, and middle finger. And that would be positive for carpal tunnel. This test, we're going to be testing for knee pathologies. So we're going to be performing a McMurray test first. I'm going to ask Jacqueline to flex her knee, and then immediately putting pressure on it and internally rotating that knee. Right, and then she would feel any pain along the cruciate ligaments of her knee if this is positive. We will be performing the valgus and the varus test. For the valgus test, I will be putting medial pressure on the knee, lateral pressure on the ankle. And for the varus test, I will be putting lateral pressure on the knee and medial pressure on the ankle. Looking for any pops and clicks in that knee. Okay, we're going to be performing some additional knee pathology tests. First, we're going to be doing the Lockman. So I'm going to ask Jacqueline to flex her knee again for me. Place it down flat, putting pressure, stabilizing the back of the knee above the kneecap, and then pressing down and back up. And you're looking for any laxity in that knee capsule joint for the posterior and the anterior cruciate ligament. Next, you'll be performing the anterior drawer test by placing two hands behind the knee and pulling towards you, testing that ACL, and then pushing towards the bed for a PCL injury. Is there any pain when we do that?
Nope.
Okay, good job. Next, we're going to ask Jacqueline to straighten her leg out, and then we're going to do the straight leg test, which is as it sounds. You're going to ask her to lift her leg and then bring it on back, and that would be testing for any lower lumbar issues. For musculoskeletal and most other exams, you want to test bilaterally for the purpose of this exam, and you also want to test from asymptomatic to symptomatic, so you get a baseline for normal of the patient. For these next knee hip pathology tests, we are going to be using the fader and Faber tests, and the name spells out what it's going to do. So for the Faber test, we're going to flex, adduct, and internally rotate. Good. And that's testing for sciatic nerve pain. And then the Fader test is very similar. So it's flexion, adduction, internal rotation. Good. You can come back down. And then the Faber test is flexion, abduction, external rotation. Good job. And bring it back. Any pain when we do that?
Nope.
Okay. For this next test, we're going to be doing the thigh thrust test. So Jack can flex that knee for me. And then rotate over here. So you can place your hand behind their back, on the small of their back, and you're going to bring their knee back down, and you're going to thrust down and causing any pain in the gluteus. Special test is called the Kemp test, and you're testing for any issues with the lower lumbar spine. And we're going to ask Jacqueline to extend her back and laterally bend to either side, and feeling for any impingements that may come off the spinal process. When testing a cognition, you can do what we did in the beginning in asking if they are alert and oriented, and you can multiply that by ×4 or ×3 depending on where you are by asking person, place, or time. Or alternatively, you can do a mini mental status exam, which further will tell you the status of the patient by asking a couple questions, similarly to the questions we asked before, and then going more in depth. Jacqueline, can you tell me the year?
2021.
The season?
Spring.
How about the date?
Today is April 25th.
Good, perfect. Now, what state are we in?
Connecticut.
In the country?
United States.
How about the town?
Hamden.
Good. And if you're on a hospital, you'd ask what hospital and what floor to further ask them. Then I'm going to ask you to count. You could ask them to count back from sevens, or you can ask them to spell world backwards. Can you spell world backwards for me?
Sure. DLROW.
Good job. Now, what I'm going to do is I'm going to ask you to remember 3 objects, okay? Banana, fork, spoon.
Spoon.
Okay, good job. Then at the end, I'm going to ask you to repeat those to me back, okay? Next, I'm going to show you 2 objects, and I want you to repeat that back to me what they are.
Sure.
Okay? So you can just use any 2 objects. Jacqueline, what's this?
A pen.
And Jacqueline, what's this?
A notepad.
Good. And what are the 3 words that I said to you before?
Banana, fork, and spoon.
Good job. All right, I would like you to take a piece of paper in your right hand, and I would like you to fold it in half. Okay, and then fold it in half again, and then place it on the floor for me. And this is to show that Jacqueline can follow directions. Jacqueline, can you repeat the phrase, no ifs, ands, or buts?
No ifs, ands, or buts.
Okay, great. One more thing. I'm going to draw an image on here. It's usually 2 trapezoids that are touching each other or intersecting. Jacqueline, can you draw the image that I have on the piece of paper? Okay, I'm going to write a little sentence. For this purpose, I'm going to say the sentence. It says, close your eyes. And I'm going to ask Jacqueline to repeat this sentence. You would not tell your patient what the sentence says, but for this we will.
Close your eyes.
And then can you perform that task for us? Okay, good. And now I'd like you to make up any sentence with a noun, a verb, and an adjective.
I went to yoga and it was very fun.
Perfect. Thank you. And Jacqueline will get a perfect score on this mini mental status exam. Okay, Jacqueline, for the last part of the test, I'll be testing your cranial nerves. So what we're going to do for cranial nerve 1, olfactory, have you noticed any disturbances in your smell or anything like that?
No.
All right. Can you smell what this is?
The pen.
Good job. All right, now I'm going to ask you to look at the Snellen chart over there. Can you read the line in the middle right there?
LSDWV.
Good job. All right, now I'm going to ask if you could please follow my pen. And we're testing the 6 cardinal fields of gaze, looking for any nystagmus or strabismus or psoas. Good job. And that's cranial nerve 3, 4, and 6. For cranial nerve 5, the trigeminal nerve, we'll be feeling for a facial sensation. If you can close your eyes. Can you feel this?
Mm-hmm.
Can you feel this?
Mm-hmm.
Okay, good job. And I just want you to open your jaw. Okay, we're testing jaw strength for that. Next, we'll be moving on to 7. All right, so what I'm going to ask you to do is a series of movements.
Sure.
So I would like you to close your eyes. Keep me from opening them. Good. Open your eyes. Raise your eyebrows. Puff out your cheeks. Don't let me push them in. Okay. Good job. Smile for me. Frown. Good job. Next we'll be doing the hearing test, right? And we did that with the Rhines and the rubber test, so we know that works. And you can also take your fingers here, and you're going to ask Jacqueline when she stops hearing your fingers.
I still hear them, yes.
Okay, good. Good job. And next we're going to be doing cranial nerve 9 and 10, so that's your tongue. We're going to ask her to swallow for us. Good job. And we are going to ask her to swallow and make sure that uvula rises. So if you open up your mouth, swallow one more time. Good job. Okay. And we're going to ask her to shrug her shoulders. Good job. And that's going to be testing the spinal accessory nerve. Lastly, we're going to ask her to stick her tongue out, testing the hypoglossal nerve. And if you can just bring your tongue out to the side and then bring your tongue back and up and down. Okay, good job. For these tests, we are going to test her strength, scoring from a 0 to 5. Most patients are a 5 against resistance, and if you see a 4 or a 3, it's unlikely unless they're injured or if there's a severe lesion or deficit that's going on. So we're going to ask Jacqueline, we're going to test her C5, and I'm going to ask her to bring out her arm in abduction. I'm going to be pressing on her deltoid. Good. And now for C6, I'm going to be pressing on her wrist right here. She's going to flex her bicep. Good. And then she's going to supinate. Good. And then for C6, it's the wrist. We're going to pronate that wrist. Good. And we're putting resistance on it. For C7, I'm going to ask her to extend that tricep. Good job. And then for C8, moving down, we're going to take her thumb for her pollicis, and we're going to ask her for thumb abduction. Good job. And then for L2, we're going to ask her for hip flexion. Good job. For L3, we're going to ask for knee extension. Good job. And Jacqueline, with your knee out for L4, I'm going to ask you to bring that great toe back to us. Good job. For S1, we're going to ask her to plantar flex against my hand. Good. And I would score Jacqueline a 5 out of 5 for all these strength tests. So for coordination, we did that in the beginning because that's just how I like to start my physical exams, with testing their gait. But we are going to do some other tests, okay? So I want to ask you to stand up for me before we go ahead and sit down and do some other tests. I ask you to close your eyes, and we're going to test Romberg, which is just testing her for balance. And you'll be pressing it from side to side. Jacqueline's very solid, and she's not going to move from side to side. Anyone with a balance issue or cerebellar issue would have a deviation from that. Then we're going to move on to pronator drift. Jacqueline, go ahead and sit down for me. Keep your eyes closed, and bring your arms out in front of you. Turn your palms up to the sky. And bring them in to touch each other like that. And you're looking for any drift. Any drift might tell you if something's going on neurologically. And that one arm would drop. Go ahead and bring your arms back down. You are going to bring one index finger up to your nose. And alternatively, do the same with the other hand. Good job. Then you're going to turn your hands out and flop, flip, and flop. Good job. Next we'll be checking Jacqueline's reflexes. Okay? You're either looking for hypo, or baseline normal, or hyper. And to do this, we are going to be testing at C5, and we're testing her bicep. Good. And that also is C6. And then we're going to be testing her tricep. Behind the olecranon process, we're going to be doing C6 and 7. Flexing backwards, good job. Then we're going to be doing the brachioradialis. You can take the pointer right here, tap right there, good. Then we're going to be testing for her patella, and that's the quadriceps, so L2, L3, L4. We'll be testing right here and looking for that reflex to kick that knee out. Then we're going to be looking for clonus. So Jacqueline, stick your foot out from me, and basically what you're going to do is just bring that foot in. You're going to basically dorsiflex that foot, and if you had clonus, it would be kicking back and forth. Then we're going to be testing for your plantar response. So I'm going to be hitting the back of your knee, good. I'm sorry, back of your heel. And Babinski sign, you're going to take the back of your reflex hammer or adult object. You're going to go up and out. And in an adult or someone age 2 or older, Babinski sign would not be present. In sign, basically we're going to ask Jacqueline to stick out her hand, and then I will stabilize the hand, and I'm going to flick the finger down. And this is for testing people that are hyper-reflexive, and it would either stay flexed or flex back to us repetitively, showing us hyper-reflexivity.